Welcome to the Connected Health Podcast. Today I have Skylar Levine. She is a licensed acupuncturist and a diplomate of Oriental Medicine. Welcome, Skylar.
Hey, Vanessa, thank you so much for having me.
I would love for you to tell us a bit about your journey into holistic health.
Yeah, so I was fortunate enough, I would say, to grow up in a household that kind of used holistic health quite normally as our almost as our primary form of healthcare since I was a small child. So we grew up in California, and every time I had a cold, my mom would take me to a chiropractor that would do craniosacral and would prescribe all kinds of supplements and all that kind of stuff. And then with like acupuncture and Chinese medicine specifically, she took me to an acupuncturist when I was having really bad Achilles tendonitis as a young child and wasn't finding any relief from like physical therapy or other treatment modalities that I was trying. So it was just kind of normalized in my household and in my community to use it. And then that just kind of led to a lifelong appreciation and kind of interest in it too.
It's amazing. And
Yeah.
I don't know, you're very lucky. That's not normal. That wasn't my experience as a child. Like if
I
I
know.
was sick, I would have some Robitussin or
Yeah.
nasty cough syrup. Like that was
Sure.
not on the forefront of my parents' minds. But now that I'm older and I know better, that's the route that I'll be taking. What sparked your interest in traditional Chinese medicine and herbs?
Yeah, so in terms of the application process got me really interested too in Chinese medicine just because they had you read like a couple chapter books and then do a couple research papers and a couple reflection papers on it. And it just made me realize like kind of the wealth and breadth of knowledge that is this medicine and just how vast it is. And it really made me appreciate that I was going to move into a career of lifelong learning, which I'm certainly in now. And so the schooling of it was a 3-year master's program. It was very challenging, but I loved every second of it. It was just so amazing. But yeah, we went full time, so year round. We would get like a week off in between trimesters. Um, and credit wise, it's like a little more than a bachelor's degree, like a little more than a 4 years degree, but you just do it in a really condensed amount of time. So it was quite the process. And then afterwards, I have to take 4 national licensure exams to get licensed. So that was the schooling and education part of it.
Or
Yes.
exams? Okay, so interesting. Okay, I'm curious, across your courses, what did you study? Did you study obviously anatomy,
hmm
physiology,
hmm
biology? Did you do like
hmm
nutrition, lifestyle, exercise? Like what topics did it cover?
Yeah, all of it. So obviously, I mean, obviously the schooling was heaviest in Chinese medicine, theory, treatment, heaviest in acupuncture, point location, and then my specialty was internal medicine, so learning all the Chinese herbs, all the Chinese formulas, how they work, how they're different from each other, how they're similar from each other. And then, yeah, we had to take all the Western science classes as well. Like you said, we did take nutrition. We had both a Western science nutrition and a Chinese medicine nutrition. So that was kind of a lot of the schooling was like you had to take the same class twice in 2 separate semesters. And it was like the Western science version and the Eastern science version of it, which was obviously really cool and really enriching. And then in terms of exercise lifestyle, a lot of that was kind of baked in. We did a ton of like case study questions, or not case study questions, case study classes. We would have demo patients come in and we would go over their case and we'd have to write case reports on them. And in that, it was a lot of, not only like how would we diagnose them from a Chinese medicine standpoint and treat them from a Chinese medicine standpoint, it was what kind of lifestyle recommendations, what kind of food recommendations, are there any red flags? Do we need to refer out for anything? A lot of good medical training, in my opinion, is knowing your scope of practice. And the schooling was very, very good at that, obviously, in terms of like, we had entire classes on just like Western red flags for referral. So like, the level of urgency that they need to seek care, but that's like go to the hospital that day or like go to the PCP, within a week kind of thing. Very much getting us primed to catch that because working in healthcare, you see all kinds of things, and people just aren't aware sometimes of what it means to have pain in their gallbladder. Like they don't know that that's dangerous. They just think it's a normal pain that comes up. So
Sounds like you're very well-rounded.
yeah, try to as much as
Oh,
you can. Always more to learn.
that is so good. How would you explain traditional Chinese medicine to someone who's brand new?
Yeah. So traditional Chinese medicine, I'll start with sort of the umbrella view. So East Asian medicine is a form of medicine that views the body in meridian systems. So we view the organs as having meridian channels. So I see you've got your kind of anatomy guy behind you. So ours would have ours would look like that, and then we'd have channel lines going through the body. All of them are vertical. There's one that goes horizontal. It's kind of act like energy circuits in the body. So kind of like an electrical circuit like that you would use to turn your light switch on. They are circuits that go down the fascia plane. So if you're familiar with fascia, it's a connective tissue of the body. And fascia is made of collagen and elastin fibers, which are electrical conductors in the body. So they can send nerve impulses. Any of the electrical happenings that are going on in the body can travel through these fascia planes. And so that's what we found. Chinese medicine meridians follow these fascia lines, which are also what surgeons use to cut through. They cut through the fascia lines to minimize scarring. Um, and on these fascia planes, there are these spots that have a higher concentration of electrical activity, you could say. And these are where we find our acupuncture points. And so acupuncture points lie on a channel. This corresponds to an organ. And we use these channels and meridians to diagnose the body. So we are not in Chinese medicine, we do not diagnose in Western terms. We diagnose in our own terminology. And these diagnoses can essentially, the simplest way to look at it is that we are looking at excesses and deficiencies in the body, and we are trying to get the body to a place of homeostasis. So we're trying to clear out excess and nourish deficiencies so that way everything is kind of operating in this harmonious state. Um, the other kind of main thing with Chinese medicine, if you've never heard of it before, is that we're not looking at organs in a vacuum. We are looking at, because they run on these energy meridians, we are looking at how they communicate with one another. So we're a lot of times diagnosing based on not just the organ's function itself, but the way that it is communicating with other organs. I would say the last two is that we're also looking at sort of elements in the body. So the same elements that we see making up everything around us in nature still make up our bodies, right? Water, fire, metal, right? We've got iron in our blood, that's metal. Earth, so wood, all of these things that make up the world around us, our natural ecosystem, also make up the ecosystem of our body. And so we're using these elements, we're kind of balancing these elements in our body the way that we would want elements to be balanced in nature, so that way we don't get a crazy storm or a wildfire or all of these natural disasters that can happen. All those can happen in a different way, but in our own anatomy and physiology. The last point that I would say is, so I studied traditional Chinese medicine. There's classical Chinese medicine, traditional Chinese medicine, there's also Japanese medicine, there's so many Korean style needling, there's so many different offshoots within East Asian medicine of treating. And traditional Chinese medicine is probably, I would say, the most popular, like that's what you're most likely to find a practitioner in your area, I would say, not to say that there aren't practitioners in other fields, but this was the most popular form of medicine, the most sort of Western accepted form of medicine, because it is more scientific and a little bit less the esoteric, which is classical Chinese medicine. And a lot of people have training in both, but so yeah, if you have any questions, that was a lot.
Oh, I love that. From my very preliminary knowledge on what TCM is, I've heard of the four elements
Mhm.
before, and you can correct me if I'm
Yeah.
wrong, but people are usually dominant in one. Is that true?
So that is another kind of, so in Chinese medicine we have five elements in Chinese medicine. So we've got a fifth
Okay.
element. We have wood, fire, water, earth, and metal are five elements in Chinese medicine. There is a branch of TCM called 5E, five element, and they do a lot of element diagnosis. So they'll diagnose someone as an element and treat them that way. The form of Chinese medicine that I studied doesn't get into that a ton. It's more so like we're looking at how all the elements are interacting and balancing in the body. 5E is really cool if you are seeking out Chinese medicine for a psycho-emotional issue. 5E deals a lot with any kind of psycho-emotional stuff. And traditional Chinese medicine does too, but a lot of people get additional training in 5E because they want to really specialize in that.
Okay. That's interesting. I have so many questions, and
Yeah,
this is great because I'm sure other people have the same questions.
totally.
So, my understanding of chi is that it's the energy that flows
Mhm.
through all living beings, right? One of my clients told me a story. He was getting acupuncture, and there was a moment where his practitioner inserted a needle, and there was like this big zap that came out of the
Mm.
point. Like, can you explain what's going on there? Because he wasn't able to explain it to me, but I'm so fascinated.
Yeah, totally, totally. So chi, yes, you are totally right. Chi is the electrical force of the body. It is the animating force of all living creatures. It's kind of this elusive thing. So if you look at Chinese characters are these beautiful, like the written language are these beautiful descriptive things. They have way more meaning than just our Western words and terminology. And so the Chinese character for chi is actually this puffed rice that's like just about to boil plus air. And so if for my biochemistry people, people listening, we know that like this is the cellular respiration formula. This is what makes our cells move
Mhm.
is glucose and oxygen. And so
Wow.
this primitive symbol for chi is literally cellular respiration. It's literally, mitochondrial function in the cell that powers things to keep going, which is really cool, right? But because Chinese medicine goes a little deeper than surface science, there is more to it. So there is kind of this movement of qi that we don't necessarily see. And the same way that when you flip on your light switch, you don't see the electricity moving through the wire. You can't see the electricity moving, you see the light switch come on. Qi functions the exact same way. So we judge qi by the result of its action. So how did the organ function? We can't necessarily see the electricity like we can't see it when we're turning on our lights, but we can see the brightness of the light bulb, right? We can see how well is the stomach processing food. And so that is how we're judging qi in the body. When you get acupuncture done, you can get what we call a de qi response. Most studies with acupuncture show that if you don't get a de qi response, either felt by the practitioner or the patient, you're not going to get the same like benefit that you would um, with if you don't get that response. But that is essentially when we are putting the points, when we are putting the needles into those, what I talked about before, those um, highly electrical points, these kind of organizing centers in the body, you are more likely to get that response. So that's why, we have found these acupuncture points on the body that we utilize that are, conducting that electricity.
That's just hard to picture actual electricity, but the heart has an electrical field of what is it, 6 to 10
Yeah,
feet? Like it's real, and
totally.
that's why it's effective to get those defibrillation shocks when we like lose our
Exactly.
heartbeat. Like that's literal electricity.
Exactly. Well said.
That's crazy.
Yeah.
That's crazy. Mind blown.
Yeah.
All right, I want to know a bit more about what you do as an
Mhm.
acupuncturist. What does acupuncture do? What conditions does it help with?
See almost everything. My specialty, so I work at Shen Medicine currently, and the specialty of our clinic is reproductive, so OBGYN, any kind of a gynecological disorder. We also do a lot of fertility mostly, and a lot of ART, assisted reproduction therapy. So people going through IVF or IUI, acupuncture has been studied extensively to show benefit in those fields, and so we see a lot of those patients. Um, so those are my specialties. I also specialize in orthopedic pain conditions. So any kind of injury or chronic pain, anything like that. I see a lot of that in clinic. A lot of people come in, and I think partially that is because that is how acupuncture is starting to get popularized as for pain management, as people are kind of realizing that it has a really great effect on that. So we see a ton of pain, a lot of fertility, a lot of obstetrics and gynecology, and then I also specialize in herbs, the internal medicine, and I would say for that, I get a lot of insomnia patients, a lot of digestive patients, a lot of anxiety, fear, like a lot of kind of psycho-emotional stuff like that. We will treat basically anything as long as you are not in a one of those red flag scenarios, right, that we were talking about in the beginning of the podcast, something where it's like, oh, your appendix is bursting, you need to go to the ER kind of thing.
Let's talk about acupuncture in the psycho-emotional sense,
Yeah.
because I think a lot of people in my audience, or a lot of people in general, think about if it's physical pain, that's when you know it's something that needs attention. But
Mhm.
then there's a whole side of us, like our emotional state, our like mental state. I remember I got needled once because I was just like so stressed,
Yeah,
and I got some ear pressure points or seeds, and I literally calmed down in 15
yeah,
minutes. I was like, I felt like I was gonna
yeah,
explode, and then it just, oh, how does that work? Please
yeah,
explain.
totally. So a big thing that acupuncture has been shown to do is adjust the nervous system. So when we're in a state of stress or panic, we are in our sympathetic nervous system, and this is our fight or flight mode. This is everything in the body is turned off besides the functions that we need basically to keep us alive if we were running from a bear, something that would keep us alive in an acute stressful scenario. What acupuncture has been shown to do is put us in a parasympathetic nervous system state, which is our rest and digest mode. And this is where we can get blood flow circulation to other organs, to other body systems like the digestive, reproductive. We can, you know, slow the heart rate. We can kind of calm the body, readjust the nervous system in that way. So that is a big reason why acupuncture puts us in that calming state is that we can get into that parasympathetic state. Another thing that acupuncture has been shown to do, it's been shown to release endorphins in the body. So that same good, like happy feeling, relaxed feeling that we get after getting a good workout in, we can get actually with acupuncture. And so that helps calm the body down. From a more Chinese medicine standpoint, right, we're balancing the body out. So if something's really hyperactive, we're trying to bring that down. We're trying to ground it, we're trying to anchor it so that way you're not kind of in this like state up in your head. You can let things actually like ground and anchor you. So yeah, it's cool stuff. And then the ear stuff, a lot of people ask about that because a lot of our main, we call it Shen, like spirit calming kind of points, Shen calming points, mind calming points, they are found in the ear. And a lot of people are really confused by this, understandably so. But the reason is we have 12 cranial nerves and all of them pass through the ear. One of the cranial nerves, I believe it's cranial nerve 10, is the vagus nerve. If you've heard of the vagus nerve.
Oh, yes.
And
We talk about that a
yes,
lot.
okay, so you guys are familiar. The vagus nerve then passes through the ear and it innervates a lot of the viscera and digestive organs, and it has a really strong implication for that parasympathetic nervous system state. And so we were able to kind of influence that vagus nerve auricular points through ear points and acupuncture and
So we can really access a lot through just that one nerve, which means we can access a lot through the ear. So that's another cool thing about Chinese medicine is that we use microsystems. So we see the ear as a microsystem for the whole body. And it makes sense when you see what those nerves control, that we can kind of influence the digestive organs through the ear. It's pretty cool.
Very cool. What are your tools of your trade besides needles? I know that's very important in what you do, but what else do you use?
Yeah, so needles are the big one. I use a lot of herbs. Yeah, a lot of herbs, a lot of supplements. The clinic that I work at right now, we buy all of our herbs in capsule form, so mostly prescribing capsule herbs, though, certain clinics will have like a granule pharmacy or a powder herb pharmacy where you can make formulas that way and prescribe them to people, but we find that compliance is a little bit better when they're not having to drink I should say the Western palate is not primed for Chinese medicine herbs. And so when people aren't having to drink these teas, which I honestly love the taste of, but people aren't necessarily used to it. So we find that capsule form is better compliancy. So herbs are my second biggest tool. The other tools of traditional Chinese medicine have actually gotten very popular nowadays. So gua sha is like a very now popular tool. People use it on their face. PTs have adopted it. They call it Graston technique. And then cupping is another big Chinese medicine modality. So we traditionally do use fire cupping, which you basically like light a cotton ball on fire and put it in a glass cup and then quickly take it out and put the cup on someone's back or wherever you're wanting to cup. And that creates like this vacuum seal. So that's how we learn to do it in school. Most clinics will just use suction cups. That's what we use at my clinic now. So cupping gua sha, moxibustion is another big one that we use in Chinese medicine. So we burn an herb called mugwort in the body. There's a few like forms that we kind of use it in that are harder to explain verbally. It's easier if I were showing you, but we burn them over places in the body, and there are different ways to burn them that produce different results. So there's more dispersing method that we would use, like if someone has pain, and this one's really cool. You can see the result of it. If someone comes in with a big bruise, then we'll do this form of moxibustion on it, and you can literally watch the bruise like start to dissipate and like kind of start to open up because it's moving out that old blood, that static blood that's just sitting there, right? Because that's a bruise, it's just kind of this blood that's pooling. And so it's moving out that old blood and letting new blood get in there. So moxibustion as a warming technique as well. So we use that a lot, like over the ovaries and the uterus for menstrual pain. It just goes a little bit deeper than like a heating pad or something, which is more surface level. So I'm trying to think if I missed any ones. Seven Star Blossom is another tool that we are trained in. It sounds terrible. It sounds like a medieval torture device, but it's not. It's this little tiny hammer. It's like the size of a the head is like the size of a nickel, I would say, and it has 7 tiny needles on it, and you just tap them on top of the skin, and it's just an activating or dispersing method that you would do. So none of the needles actually go through the skin, they just tap you. And that one's not used a ton in clinic, to be honest with you. We don't some of these, it's we just don't like, we trained in all of them, and then you don't end up using them a ton, so that one you won't see as often if you're going to see an acupuncturist. And then we'll use like heat lamp, infrared TDP. At the clinic I work at, we have a biomat that is on the table that people can lay on. And then we also have red light therapy that we'll use for people as well.
Do you do the tongue mapping as well? Is that part of it?
Yeah, so tongue and pulse are big diagnostic kind of criteria that we use in Chinese medicine. So we'll look at the tongue and we'll feel the pulse. There are 3 pulse positions on each hand, all have 3 levels, and they all correspond to different organs. And so if you are having a Chinese medicine practitioner like feel your pulse for a really long time and you're like, there's not like you could just get a pulse ox thing and like, take
Mhm.
my pulse rate that way. Like that's not what we're feeling for. We have 29 different pulse qualities that we're feeling for, trying to figure out which one is predominant in each organ position. And that is part of our pattern diagnosis.
That's very specific. Amazing. Okay, so you've talked about where you work and the most common issues that you see fertility wise, right? What are the most common symptoms that people show up to the clinic with?
And like specifically with OBGYN stuff or just in general, like most common symptoms.
Most common symptoms that you specifically see. I'd
Okay.
be interested to hear that.
Yeah, totally. So I would say right now, my current patient load, I have a lot of amenorrhea clients, so people that have not been getting a period. Last week, for whatever reason, I got like 6 new patients that all were like, I haven't gotten a period in months or a year or whatever. They
Oh,
all decide to come in. Last week, it was like total hive mind.
hmm,
So a lot of amenorrhea, a lot of neck and back pain, lots of neck and back pain, a lot of stress and tension that present with like tension headaches, tension in the shoulders, menstrual cramps, menstrual pain, and infertility. So people that have been trying to conceive either naturally or through assisted reproduction that have not been able to do so, or they have had recurrent miscarriages. Maybe they have had pregnancies, but they've had confirmed miscarriages afterwards. So I would say currently that is what I'm seeing the most of. And then there's always a lot of stress and anxiety. A lot of people, I would say almost all patients end up listing stress or anxiety. If it's not their main complaint, their chief complaint, they'll list it as their secondary complaint that they want to focus on.
mhm. Okay. So I want to know how you walk through the treatment of a patient. So I might just give you maybe a random pretend patient and see
Sure.
what you would do. This would be like a highly stressed, busy, career focused woman who came to you because she had issues getting pregnant. What would it look like to assess her, to treat her, all of that stuff?
Yeah. So I would start with like a full intake. I would ask, how long have you been trying? I would ask what your method of ovulation prediction is. Like, are you using an LHP strip? Are you just going off of your body temperature? Are you familiar with cervical mucus? Are you aware of when your body is ovulating, when your actual fertile window is? Because a lot of people with uteruses haven't been educated in that. They just aren't aware of when they are actually able to conceive in their cycle. We have a lot of different phases. So making sure that when they've been trying, they've actually been trying when it's possible that there could be sperm and egg interaction there. So that would be the first thing. I would ask how long they've been trying. Then I would do a thorough review of their menstrual history. Are they having regular periods? What are their periods like? I'd be asking about the blood itself. Like, tell me about your menstrual blood. What color is it? Is there clotting in it? Is there tissue in it? Like, tell me everything. Tell me the day that you ovulate, like your average ovulation day of your cycle, getting a really thorough review of that. And then I'd also want to ask about partner. Like, what is your partner's lifestyle? Are they sitting with seat warmers on their car every day? Are they taking baths every day? Are they doing saunas every day? Are they doing things, smoking cannabis? Are they doing things that would impair the quality of the sperm being able to travel all the way up to the uterus? And do they need treatment? Do they need lifestyle function? So I would ask about all of that. I would ask if they've gotten any kind of reproductive diagnoses, testing, PCOS, endometriosis, like any of that. If they've gotten any kind of imaging done, saline sonograms, if we've looked at the fallopian tubes, are they open? Are they blocked? Any information you can give me. So that would be kind of the main for that. Then we would do a thorough review of all the body systems. So I'd ask about digestion. You said this person is really stressed. So we'd get into kind of stress. How do they know they're stressed? What does that look like in their body? Is it tight shoulders? Is it shortness of breath? They can't breathe. Their chest hurts. Can they not sleep at night? Tell me about sleep. And then I would look at their tongue. I'd feel their pulse. And this would all help me to come up with a TCM diagnosis. And then also kind of get my brain going in the direction of, is there anything that I need to get them seen by? Do I need to get them sent into an OBGYN for a workup? Do I need to have them go get hormone levels tested or imaging done or anything like that? Something that's kind of, if there's anything that would be posing issues or concerns in that way. And so I'd come up with a TCM diagnosis with them. If they're super stressed, I can almost guarantee you it's going to be something with the liver in Chinese medicine terms. That's kind of our main stress organ. And so it's going to be something with the way that the liver is holding qi and it's not letting it course to the body appropriately. And, a lot of people, if people are coming in with like that tight, like muscle tension kind of stress, like they're irritable because they're so stressed, that's a lot of like liver stuff. And so I'd really tease out that diagnosis. What is excess? What's deficient? And then I would treat them with acupuncture and herbs. In that scenario, I do a lot of phasic herb prescriptions. So I'll give someone one formula that they'll take for the first half of their cycle, like kind of midway through their bleed up until they ovulate, and then another herb that they would take from ovulation until the first few days of their menstrual cycle that just kind of helps to support the normal hormonal fluctuations that happen in our body and giving us the materials that we need to support those hormone productions. And then usually what a course of treatment looks like for that is going to be typically once a week for 12 sessions. Egg cycle is 3 months, and most studies of acupuncture show that you have to be consistent. So you have to go at least once a week for the first 8 to 12 sessions in order to get result. And that's just, acupuncture is very similar to going to the gym. If you go to the gym consistently in the beginning and you build up your strong muscles, it's a lot easier to maintain them. But it's really hard to make any kind of progress if you're going like once a month. And so in China, treatment courses will actually usually be like 3 to 5 times a week for a certain amount of time, like, a month to 3 months. So they go a lot more than we even prescribe in the West. But typically once a week for 12 weeks is going to be kind of our standard baseline that we're looking at for any kind of OBGYN stuff and a lot of conditions in general, honestly.
Tell me more about the herb side.
Yeah. So the herbs, we diagnose and treat with herbs the same way that we would with acupuncture in Chinese medicine. So we're operating off the same diagnosis. The caveat is that you have to be a lot more accurate with your diagnosis when you're working with herbs. If you choose an herb formula that's not good for the person, they'll get a little bit constipated or have a little bit of a loose stool or it just won't work as well. But you have to be a lot more specific to have success with herbs. So, similar treatment principles and qualities and all that. We're looking at herbs in kind of similar categories with like the elemental stuff. And, we have herbs that are warming and herbs that are cooling and herbs that regulate chi and herbs that nourish blood and all these different categories that we're pulling from. And you just kind of have to really know what's going on with the person to give them herbs. So that's why it's an additional field of study. Um, and then another thing that's kind of cool about the herbs is that we really never prescribe, very, very rare will you prescribe a single herb. Most of the time we are prescribing formulas. And so Chinese medicine formulas can have anywhere to from 4 to 20 herbs in a formula. And so you have to be really aware of how the herbs are working with one another. But that's where the beauty really comes in. Chinese medicine, again, it's a holistic medicine. It's looking at how systems work together and it views herbs in the same way. So we're looking at how herbs work together to create this formula that's balanced in just a way to have a certain effect on someone.
I think that's different from Western medicine, where they prescribed medication that affects one system of the body, but doesn't help another system of the body. So they have to take another medication to fix
Yes.
that one. And it's just, oh, all the side effects and everything. I'm curious about your most commonly prescribed or most commonly used herbs, or even what are your favorites and their
Yeah.
benefits?
One little side note actually on that I'd love to pause on is that what you just mentioned is actually something that has made it really hard to integrate Eastern medicine into Western culture and philosophy. And that is because in Western drug trials, what we're doing is we are taking a large group of people that have a certain symptom, right? So let's say headaches. It's a large group of people that get migraine headaches. In Western drug trials, we are seeing, does this one drug take care of headaches in however many people? The more people, the better, right? That's, we view, that's kind of our gold standard, is the more people, the better. Does it take care of headaches for these people? And when you try and put Chinese medicine in that model, it simply doesn't work because we don't prescribe like that. There's not one formula that I would give 1,000 people that have headaches. I'm going to give probably a different formula to every single person because their headache from our sense is coming from a different cause, a different causative factor, a different root cause. And so we're looking at more of that root level, your headache is not an ibuprofen deficiency, but
Yes.
ibuprofen does block the pain pathways so you don't feel it. And so Chinese medicine, we're looking at the root cause, what's happening that's creating that headache. And that's going to be very different for every person. So that's why Chinese medicine has proven difficult to study in what we consider gold standard Western research. A lot of Chinese medicine is much better studied through case studies, through clinical, I'm at a loss for the word, but something that you would implement in your clinic and do kind of like a case study on a person or what have you. So that's just a note that I always like to bring up when people are like, why is there not like good like why do we not have research on Chinese medicine? Well, we do have a lot of research in Chinese medicine. A lot of it unfortunately is not translated in English, and a lot of it is also not what we accept in Western terms because we can't standardize it the way we do Western medicine.
Are you
Um,
saying that the traditional Chinese medicine model is more on the individual rather than the mass?
It is, yes. So in order to do like a Chinese medicine study, you would have to have a Chinese medicine practitioner that is individually diagnosing every single person and giving them a specialized formula for their headache versus giving one formula to a ton of people, if that makes sense.
It
Um,
does. And I like it
yeah,
because not every patient should be treated the exact same way because everyone's biology is just a little bit different.
exactly. And it gives us a lot of explanation, right, for why you can give the same treatment to two people and why it can work for one person and not work for the other.
Mm. Yes. Tell me more about those herbs then.
Yeah, so I would say probably the most commonly prescribed formula in our country is on. This formula helps to regulate the liver. So we talked about liver being like a big stress organ. And this formula is made for someone that presents with both excess and deficiency. So they have excess in that their liver is in a state of excess if they're really stressed, if they're feeling irritable, and then their spleen, which is kind of our what we look at as a digestive organ in Chinese medicine. And what we look at is being able to get the nourishment from our food in order to get raw materials in our body to like to build blood and really just all of our body systems. So this formula is balanced between liver qi stagnation and spleen qi deficiency. So kind of that excess and that deficiency helps to balance people out. And this is something that I would say if anyone has had a Chinese herbal formula before, they've probably had this one. It is probably the most widely prescribed, one of the safest baseline. You could take it for your whole life and not have any side effects. Like it's a very easy formula. If you've gotten ads for Elix, which is like a Chinese medicine, kind of like a new age Chinese medicine or brand, all their formulas are just variations on this Xiaoyasan. So that is probably our most widely prescribed formula. I with that being said, I probably have maybe 10 total patients on it. It's widely prescribed, but it's not always the best call. And so a lot of people, when they don't have training in herbs, will just kind of prescribe that because it's kind of beneficial for everyone. But, if it's not like really getting to it, then you need to have something a little bit more specific than it. So that's a big formula that I use a lot for sleep disorders is called Swanzhao Rentong. And this one is just kind of a really good general sleep formula. A lot of people respond well to it. I have a lot of people that have this specific pattern diagnosis for their insomnia, and so I use this one a lot. Another formula that I use, the traditional formula is called Guizhi Fuling Wan. I use a variation on it, and it's a more specific gynecological variation that I use. And I have really, really great results with that for people that have menstrual pain, either from endometriosis or if they have any kind of cycle abnormalities from like PCOS or anything like that. This formula is like we call it a blood stasis moving formula. So in Chinese medicine, anytime there's pain, that's a sign that there is either qi stagnation or blood stasis. Something is not moving in the body. There's some kind of a blockage in the body. Things are not moving through it. When there's no movement, there's pain, there's stagnation and pain. And so we use formulas that help to move and regulate the blood. We'll say, like, invigorate the blood. If someone's coming in, they're like, I have really large clots in my menstrual blood, like, there is large clotting. That's a sign that we need to literally break blood stasis. Like, something is pooling and sitting in there, and we need to break it and move it. And this formula is great for that when people are having like painful clots and their menstrual fluid. This helps to just kind of invigorate that blood, move fresh blood out, and it's amazing. I had a patient, I've been seeing her for a month now, and this was her first like cycle, and she was coming in for fertility, but we kind of put her on a we call it like a preconception plan. So 3 months of let's get the cycle regulated, let's get the body prepared before we start trying to conceive again. Let's just take a 3-month pause from trying to conceive. And her kind of secondary complaint was painful periods. She gets just debilitating cramps. She can't get out of bed. And she presented with this formula. And so I gave her a really strong blood moving treatment before her period this last month. And she was kind of on the fence about acupuncture and herbs. And her husband was kind of on the fence and didn't want to buy the herbs, like just a little bit nervous about it, which I totally understand. And so I was like, let me just like show you in this first cycle. Like let me just like, let's just like get until your next menstrual period and like let's just see, I'm just kind of like totally get it, like I totally understand, just give me this first cycle to kind of show you what we can do and see if you want to continue and feel good about it. And so she came to see me last week and she was like, I can't even tell you, like, we were traveling and I got my period and she was like, I just didn't have cramps. She was like, I've never experienced that. Like, I am literally elated. And now she's totally, totally bought in. And so I get a lot of really good success with that formula. A lot of us know what it's like as women to have debilitating menstrual periods. And so seeing someone just say, oh my gosh, I was able to go to work that day. I didn't have to call out. I always call out of work on the second day of my period, and I went to work and didn't have cramps. I was like, yay.
That's amazing. That
Yeah.
is amazing. Okay, well, on that note, what would you say to someone skeptical about acupuncture, traditional Chinese medicine, herbs? What would you say?
I would say give it a shot. You don't know until you try. And a lot of people are shocked at how much they love the treatments. Like when I put needles in someone, I say, okay, I'm going to leave you. It's going to be about 45 minutes. We give people a buzzer in case they feel anxious. But, like I always say, you're probably going to take a nap. Most people end up falling asleep. Like it's highly, highly relaxing. Um, People are shocked to hear that, but it's the truth. And so I would say if you're skeptical, like come in for a treatment. The proof is in the pudding. Like you will feel the results. I have really, really never left an acupuncture session where I haven't felt better afterwards. And at the very, very least, you're going to regulate your nervous system for an hour. And we know the benefits of that, right? We know the hormonal benefits of that, right? The hormone cascade that occurs when we are in a stress response of
Mhm.
cortisol and all of that. And so, like, give your body that gift and just see. And then the other thing I would say about it is be consistent. Like, when we don't have results, it's usually because we're not consistent. And no shame in that, no anything, like, no worries. Last thing we're trying to do is add extra stress to your plate, but just kind of realize that. Like, if you're like, oh, I tried acupuncture for 2 sessions and it didn't do anything for me, like, it's probably not going to do anything in 2 sessions. We usually start to see results around session number 4. Something is moving, but it's not fixed. Like
Yeah.
think about how long you've had this issue. Like it takes time to unwind these things, and especially when we're dealing with hormones. Hormones are a much longer acting, and they work distally, they work far away. It takes longer to influence that. And so be patient with your body, be patient with the process, try and have a little bit of trust, find a good practitioner. I do recommend, make sure that it's a licensed practitioner. If you're coming in for pain, no shade at all to PTs, but they do not have the needling experience that acupuncturists do. So I do recommend if you are looking for dry needling, like go to an acupuncturist for it. They have had a lot more needle training, and it's going to be a lot more comfortable to have it done through an acupuncturist. And just be really open and communicative with your provider. If you have questions, if you have reservations, their job is to support you and to help you feel empowered on your own treatment plan. So really, really like lean into that and ask the questions, like, feel like do get the information you need in order to feel confident in your own treatments.
Hmm. That's so true. Thank you so much for your time today. I guess we'll wrap
Yes.
this up. I want you to
Yeah.
share with my audience one more time, where can people find you if they wanted to work with you? I know you're only local to Nashville, but please tell us where you're at.
Yes, absolutely. So, yeah, I'm in Nashville. I do like telehealth herbal consults if you want to do something like that. If you want to come see me in clinic, I work at Shen Medicine, Shen. That's right in Hillsborough Village if you're in Nashville. Beautiful location, beautiful office. I mean, total dream job. It's the most beautiful acupuncture clinic you will ever see. Like, it's just gorgeous. I'm so, so grateful to work there and to work alongside just other incredible acupuncturists. So please come see me. I love meeting new patients. And yeah, my name is Skylar Meadow Levine. And also, like, please reach out if you have any questions about acupuncture or Chinese medicine. Like, I'm just a nerd that loves to talk about it. And I love talking about it. Like I said, I dance professionally. I'm a yoga teacher. Like, I do a lot of integration with movement and pain management and all that. So reach out if you have any questions.
Awesome. Thank you so
Yeah.
much again for your time, and we'll see you next time.
Yay. Thanks so much, Vanessa.